Skilled nursing then is for that patient that is really coming to a very frail point. They couldn't live for a while. They aren't necessarily actively dying or anything, but they're starting to require the skills of a nurse, hence the title skilled nursing. These people usually have a lot of medical issues that really require oversight by an RN or an LPN. And so they are not able to live in assisted living because of the amount of oversight that they need, the amount of one-on-one care. And they may be totally wheelchair dependent where they require 2 people or a mechanical lift to get them in and out of bed. And a lot of times that's kind of the criteria that ends up defining why they have to be in a skilled nursing facility. Skilled nursing facilities are looking almost like extensions of hospitals anymore. They have very acutely ill patients that come from the hospital. Many are still on IV antibiotics, or they require lymphedema type of programs. They may have wounds that require extensive management. They may have really complicated diabetes type of issues where they require injections of medications that can't be just handed to them. They may have really unstable heart conditions that have to be managed with blood pressure and heart rate monitoring, CHF management, and particularly now because hospitals, if they've had a patient in their doors and they're discharged out to a skilled nursing facility, they actually get penalized if the patient comes back to the hospital too soon after a discharge. So the hospitals are very sensitive that these patients go to some place where these conditions can be managed by the adequate medical staff to prevent those readmissions to the hospital. The rehab services can be quite extensive, and sometimes the facilities are really geared towards rehab and not so much towards the person who's going to reside there long term. They're actually more places that the patient will pass through on their way to somewhere else to get the rehab. Obviously, this is the most expensive of the facility type of living. In-home care is still more expensive, but skilled nursing facilities run around $7,500 to $8,000 a month. And very few patients that I know actually bring in $7,500 to $8,000 a month in income. So a lot of times people who are going to reside in a skilled nursing facility are going to need some benefit filing assistance to be able to live there.